Hi, everyone. I'm Christina Veselak. I'm founder and director of the Academy for Addiction and Mental Health Nutrition. And as many of you know, we teach practitioners, both psychological mental health practitioners, as well as functional nutritionists, etc., how to integrate mental health nutrition into their practices. And today I'm having a conversation with a wonderful student of mine, Dr. Michelle Perrin.
Hi. Hi, Christina.
So, Michelle, welcome.
Nice to be here. Yeah. So you wanted me to talk a little bit about what I do.
But what you do, who you are, you do actually some very exciting things, which is why I wanted to share you with, our entire following. But why don't you start with a little bit about your training and your background, and then how you've integrated amino acid therapy into what you do.
Okay, great. Yeah, so I've been an alcohol and drug counselor for 17 years. I'm licensed in Michigan, Minnesota, and Wisconsin, and in parts of Ontario as well. So try to work the border. And for 17 years, for the first 10 years, or 9 years, I worked in brick and mortar and in my local town. And now for the last 8 years, I've been working online exclusively 100%. I used to work for a big national company. I was a senior clinical supervisor there. And then
Huh?
once they merged with another company, I decided to go out on my own rather than compete with a lot younger folks and try and work 80 hours a week again. I wasn't interested in that. So,
And you're a PhD psychologist, right?
counseling, a
Counseling.
counseling
Okay,
psychologist. Yeah. So,
got it.
and yeah, so I got my degree at Capella University. So that was also all online as well and very rigorous, was the hardest schooling I ever did. But anyway, so after that, as I worked in clinic and in agencies online, everything was going really well, like I said, until the company merged. And I believe the reason why I didn't stay on with the company most importantly was because what I was doing for them was developing a program of moderation under the umbrella of abstinence-based traditional treatment. And so in
Hmm.
the specialty, we were offering that for people who would otherwise not engage in therapy or treatment for their drinking. And we're also
Right.
offering that to people who had completed the program successfully, but would mention that they were uncertain if they'd go back to drinking. And rather than have them go off and repeat the same thing again, they would enter my program so they would learn ways to be more responsible and behaviors and mindsets around drinking. And we would really look at setting and all that. So we got people all set up that way. However, what kept coming up, and as does with all those clients, is cravings, 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 cravings. And so it's just an overwhelming thing. Even if someone moderates, depending on the concurrent physiological presets, it can be a lot worse for some people than for others. And so I said, there's got to be something else. And I looked and looked and I never found anything. And until I was inadvertently at a meeting and heard about amino acid therapy and was suggested to come to your course. And so I looked everything up and, oh, I don't know, it took about 3 days and I was good. I was like gung ho to join after I'd spoken with you. And so, yeah, here I was. So since joining the program, I'm in the internship portion of the first accreditation. But once we started learning it, there was a lot to learn. It was a meaty course. It was super helpful. It was logical. It was scientific. It was something I could actually do to help my clients. And what it actually did, it's changed my paradigm from seeing addiction so much as a disease, as instead it was a condition created by these environmental factors as well as physiological factors. You could see that. So all of a sudden, whenever I would get new clients, I would just see it in such a different way rather than SSRIs or medications taking the primary seat. I'd see, well, those things were prescribed because of the starving brain. The starving brain was like a mind blowing concept to me. And so, because I'm so enthusiastic and excited about that now, my practice always includes a conversation about what are you eating and how are you
Uh-huh.
sleeping and what medications are you on. And I would say that probably 9 times out of 10 I start off with that now rather than so tell me other things. So I it's just blown me away. It's just been great.
So that's wonderful. Of course, this is what I love to hear. But I'm really curious about what changes you've seen in your clients since you've started this.
Yeah. Oh, wonderful changes. People come to me often who are not able to control their binge eating alongside of their drinking or using marijuana or whatever it is. And as we start to introduce these um, amino acids, we start seeing changes. People are eating more regularly, they're sleeping better, they're reducing their use or even eliminating their use. We seem to come to extinction. My main focus is using targeted naltrexone in my practice. And
Hmm.
so I do have to time the tyrosine with the naltrexone so that the dopamine receptors aren't interfered with. However, that seems to work because people on targeted naltrexone generally don't drink every day. They may start out that way, but within a short period of time, usually 30 to 60 days, they stop drinking daily and they become occasional drinkers, or they'll start by reducing no drink. They'll have alcohol free days. And the longer they do it, the more alcohol free days they have. So we have all this time, usually 4 or 5 days a week for most people, pretty quickly, where they're not drinking, which is lovely
Hmm.
because the tyrosine can take most of the action. The naltrexone has been metabolized off the receptors, so they have full range of emotion. They can feel super happy rather than flat, which is what happens with a daily dose of naltrexone. And the time of day naltrexone is taken is at 3 in the afternoon or 4, your witching hour, we call it, as opposed to in the morning, because it's a quickly metabolized chemical. And so when you take it in the morning, your cravings generally aren't in the morning unless you're a morning drinker. So they are usually later after work or later in the afternoon or even after lunch. So when you take the naltrexone later in the day, it turns things around. So that little bit, and now I can add something that is a physical thing that can help them, that they feel better almost instantly within a day or two. And it's just like, wow, I didn't know that all this time for 17 years, I didn't know that we could be doing this. And this should be standard operating procedure in my
It really
specialty.
should be, shouldn't it? Yeah,
Yeah.
yeah. It's almost criminal that people don't know this.
Yeah.
So, do you have any little stories you can share with us?
Um, let's see. I've had quite a few people now. Um, I had a trainer, this beautiful woman who was training but feeling a lot of depression and feeling sort of lack of energy, and she just couldn't put her finger out. She was on Adderall, but she wouldn't take it all the time because only when she felt like she was dragging. And so she came to me, and she was one of my first clients, and so I did a lot of supervision about around that, and we were able to get her on tyrosine and DPA, and she didn't need a lot of serotonin supplementation, so got her on those aminos, and it's now 2 months later, 2.5 months later, and she has energy. She's sleeping better. The only issue we have is the DPA right now is hard to get. So she was on DLPA. She didn't feel but much different on that. And so we wanted to go to the DPA to sort of target her depression and weepiness. And she wasn't really
Sure.
depressed. She was more like weepy, just, you know,
Yeah, just a little
didn't,
bit of endorphin
yeah,
depression. Yeah.
yeah. Yeah. And so she's coming along beautifully. And she's one of the best reporters. She documents everything. She writes everything down like to the detail. So when I ask her questions, she has everything just journaled and organized so that she knows exactly how she felt taking each amino. It was super helpful.
So it seems like using the aminos have changed your outcomes
Yes.
or lowered the amount of meds you other meds that your clients are having to take. What
Yeah,
do you think?
lowered, if not eliminated, other medications that clients are taking over time.
Mm.
Also, they feel better sooner. It's not this long, relapsing, stuck in the mud, I'm a failure sort of thing. It's not that. Because when they start feeling better, they start functioning better. And
Yeah,
then they
yeah.
have more control, being that we're using targeted naltrexone. They also, are more compliant with the naltrexone. They're really reevaluating, why am I drinking today? That's the biggest question.
Hmm.
My
Hmm.
one of my mottos is drinking's not the problem, and it's like heretical to say that, right? Like you're a heretic. But I really truly feel the problem is over drinking. Drinking too much is the problem, not the
Sure.
occasional glass of wine out to dinner. It's not going to
No.
ruin your life. But if you have 2 bottles of wine, which is really a common thing for most of my clients, they're starting out at 2 bottles of wine or a box of wine, over the weekend, or because they're stressed, but they're not looking at, why am I stressed, or why am I using this? So we really look at that. Makes a big
Mhm.
difference. And adding in the aminos, all of a sudden they're able to follow through with their intentions, which the follow through wasn't quite there without the aminos, for sure. Yeah.
That is so cool.
Yeah.
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 I,
You
I'm
see
I'm
that over and over
enthusiastic.
again.
My last client, I just signed him up last week, and he's like, I will do anything you tell me to do. Once his wife was on board, we met, the three of us together online. And when she had to leave from the thing, she gave me a heart sign. This from a woman who
Oh,
was skeptical and upset. And I said, no. And both of them kept saying, this is scientific. I said, yes, it actually is.
yeah. Oh, that's so cool. So you're doing some other really interesting things. You're putting on workshops, you're developing an app. What are you doing?
Yes, absolutely. So because when you're in private practice, you're working by yourself, you have to get you have to be seen and heard out there. So part of the promotion and marketing sort of thing. So what I've been doing, I've put together nutrition and recovery workshops, and also what causes late stage relapse, and comparing that to what I know about now brain function and the starving brain, and also trauma exposure. So putting that all together, making workshops out of that, so that I can present. So I presented at a specialty one. There are quite a few people there. It was a tsmmeetups.com is one place I do it. I also have a regular ongoing workshop at Thrive Recovery, which is also an online forum for targeted naltrexone. And yeah, and I'll just show up and talk about this to anyone. I wish, actually, I'm thinking I would like to do this going to as CEUs for different treatment centers. I'd like to show up and
Mhm.
talk about this to educate other alcohol and drug counselors, so they know there is more that we can do to take care of our
Have you
patients.
thought about speaking at some of the big addiction conferences?
No, I thought about, now that I have it, I'll probably, because I have spoken at our local regional conference for addiction. And so that's
Mhm.
definitely something I'll put in for next year. Yeah,
Yeah, yeah.
done already this
I
year.
think you should. But I can see you talking about integrating amino acid therapy with targeted naltrexone at some of the really big national conferences.
Oh, wow. That would be great. I just came from an invitation only Institute of Addiction Medicine, which was completely all about the big names and researchers in the naltrexone field and what they're
Uh,
doing with that, including, the original person who was part of DuPont that put out naltrexone. And so that was an honor to be there and listen to like the forefront, the spear of the arrow in terms of naltrexone use and how we can incorporate that, and also the providers of that substance online. And what I did also realize is that therapeutically speaking, some of the techniques that I use that are extremely successful with clients, they had not heard of. So they were like looking at me sort of, what do you mean there's no surprise drinking? Like, how do I control my surprise drinking? Well, no, I instigate a notion as part of my method. It's called planning, track, plan, and visualize. Visualization, we know, is very powerful. So if I see myself happily taking my aminos, happily taking my naltrexone when I plan to drink and planning on drinking, I always say let her rip drinking is not a plan.
right,
And so
right.
you have to plan it. And when you're planning, plan your peak end, which comes to us from positive psychology. How do I leave the party happy and satisfied? No one ever asked me that in high school when I was learning to drink. I was learning let her rip drinking, as most of us do, unfortunately. So yeah. So we just do that. And people tend to really relax when they know there's no judgment, and they can talk about their volume each week and have the accountability. And it's just really, and then I get them into the group forum, and in a group, I can often just sit back and listen to people have really good discourse. So,
So it's a really different approach to naltrexone therapy because I've
yes,
always been concerned about naltrexone because of how over time it blunts both dopamine and endorphin response,
yes,
leading to sort of a flatness, a
yes.
ahedonia. which is really reward deficiency syndrome, which
Yes.
by itself can create cravings in people.
Yes. I once had a psychiatrist, a lovely man, and a psychiatrist is well educated as they are a doctor first and then get a specialty in psychology. I assumed that he knew as much as I did. He became my
Hmm.
client and he was attending group and he was a good participant and he was rather quiet. And he asked me one time in group, he said, "Do I need to take this naltrexone every day?" I said, "No. In fact, don't take it in the morning, take it in the afternoon and only take it on the days you drink." And he's like, "Really?" I'm like, "Yeah, give it a try." He came back the following week so animated. I had to pull him aside and ask if he had been drinking. And he said, "No, this is how I have always been. And my wife was complaining that I was getting boring." And he said, "Now I know. Now I know how to use this properly." It was night and day. He was so much more friendly and smiley and communicative. He was a different person within a week. Just amazing. So he went forward then using naltrexone in a targeted way, which was it was a dramatic difference.
Right.
Yeah,
But that's where you get the benefits of it to, extinguish the positive response from the alcohol without that overtime flatness that is really destructive to people's
it is.
lives.
People say I don't feel like myself anymore. My wife doesn't like me, or my husband thinks I'm boring because I don't feel about anything, like nothing really matters. They get really blah. So what we also suggest on the days you don't drink, do something fun. Do something you really enjoy, laugh with your family, watch a comedy, do something that's going to stimulate those dopamine receptors so you get a better reward when you're not using it. So yeah.
Well, yeah, because a lot of people drink or use other substances because of underlying genetically driven reward deficiency syndrome, where
Yeah.
not enough dopamine's being fired at the nucleus accumbens anyway.
Yeah.
And then they bring in a drug like naltrexone because they don't know any better that flattens them even more. And there is no joy in life, and even alcohol is not working anymore. And
And sad to see people just become like literally a shadow of their former selves.
mhm,
Literally.
right.
And so when they come awake again, it's so nice, especially with this in particular, this client that was a psychiatrist. It was just amazing to see the transformation. And he had gotten
Oh,
married again, he had a young wife, and so he wanted to stay energetic and fun. And yeah, so
sure, sure. Well, and then when you add tyrosine to actually rebuild dopamine stores
yeah,
and support the whole reward pathway with the other aminos, we can get a complete turnaround.
yeah. Yeah, it's just amazing the difference it's made. So I am so excited about that. And my latest project, which I started a few months ago, and it does take time to get it all done, however, is an app. I'm making an app for the phone. And as part of that, there's a guide that goes along with it. That's a PDF that you send to clients who sign up for the app. And in that app, I have dedicated, which I would have never done, pages and pages on um, um, information about naltrexone, but also information about the option of having amino acid therapy. And then it even goes on from the 5-star diet. It has some high protein snacks that people can have every 4 hours, like a whole lot of suggestions. That banana pancake with cottage cheese, the high protein banana pancakes, which is appealing for most people. It's a sweet,
Yeah,
breakfast
sounds
choice.
yummy.
Yeah. Yeah. So I would have never done that had I not gone to amino acid school. Yeah. And so that's opened up a whole new area that I can have. And what's really great is the app is called Splashed, not Smashed. And the reason I named it that was because I came across a hashtag on Instagram and it was damp lifestyle. And I thought, that is so unappealing.
Right.
A damp lifestyle. That's not what I want to do. And so looking for synonyms and looking for something that's a little more energetic and a little more fun. And it's really aimed at teaching people what moderation truly is, which is not an arbitrary thing. I also do panel discussions at moderation management, and so many people have no idea what we could be doing or what moderation really it truly is. And if you look at all of like Dr. Huberman, Dr. Amen, the CDC, you have to look at what's recommended? No more than 3 to 4 days a week, no more than 2 or 3 drinks a day at the very most, or even, a stretch goal, maybe 2 a week, and also being um, um, irregularly irregular so that you're not even, having the same amount of alcohol every week. It's not an obligation. And so as we
Mhm,
train
mhm.
people out of that new behavior, they start to get it and get it relatively quickly. And so now with the amino acid adding on to, it was 60% of people could do my program without having to take naltrexone, which was great. Sometimes there'd be 50% of people, sometimes it would be 40% who were on the naltrexone, but we all met together and talked about the same philosophies. And I think with the amino acids, that's gonna even improve. I think that's gonna be even better.
So this is really within the overarching category of harm reduction, isn't it?
It is. However, I don't use the word harm reduction. I prefer moderation because it implies that even one drink is harmful, which may be
Mhm.
biologically, but with the chemicals in our food today, the brominated breads and the glyphosate on all of our wheat product, all of that,
Sure,
and the
sure. A
sugar and
glass
all.
of wine is not going to do any more damage for most people.
Yes, yeah. And so
Yeah.
I like to say that it's moderation and learning to control your drinking. Because the other thing is, I did work in drug courts in the early part of my career, and that was truly harm reduction because we were working with people on hard street drugs and paying them to stay sober, and it was, incentivized thing. And that was really how I got introduced to harm reduction. And I don't see moderating alcohol at single digits per week as harmful. So I try to shy away
Got
from that.
it.
Yeah.
Got it. Got it. Okay. So what about, my idea of eating protein every 4 hours, reducing cravings and drinking
Absolutely a
juice
game
episodes?
changer the
Uh,
first day. When people do that the first day they'll even text me and go, "Oh my gosh, I feel so much better," or "My cravings were down," or "I had a free alcohol day." And I know myself too, as I started practicing that, making sure I was getting something, I'm much more available in the afternoons rather than having that after lunch nap. That went
sure.
away once I started eating more protein every 4 hours, and taking the L-tyrosine made a big difference. Yeah.
Yeah. Yeah.
And unbeknownst to me, prior to taking the amino acid course, I did not know I had depleted catecholamines. I didn't know. I just felt I was dragging. I wasn't feeling like myself. I had lost my father, and that grief, that year, I had 6 months of visiting him 5, 6 times a week while he was in a dementia full care locked facility, and
Mm,
then he passed away, and then I just had the next 6 months were just sort of limbo. And I
mhm.
now realize too that high stress, even grief, can deplete your neurotransmitters. I did not know grief could do that.
Absolutely. Yeah.
And it was night and day, night and day. I mean, my house, I have some ADHD, and the house was getting really messy, and I couldn't understand why I couldn't keep up. I had no
Eh,
motivation. The afternoons were wasted after 2 o'clock. And then you had us trial everything. So when I trialed the L-tyrosine, I was like, maybe I don't even have ADHD. Maybe this is what it's been all along. So it was
uh-huh.
a changer for sure for me. Yeah. My house cleaned up.
But for that,
I got back
that
to,
that's wonderful.
yeah. Yeah. It's just been, it has, like I said, I think this should be standard operating procedure, especially in the addictions field, because the neurotransmitters are so directly depleted by drug and alcohol use that to ask somebody to white knuckle it for the first year with no repletion, with no help except willpower. Well, I learned that willpower is a reservoir. It's full in the morning, and by the afternoon, even with micro decisions, the pool's empty. So you're now going to go home and try and not drink. We
Uh,
set them up for failure, really. And I worked in high intensity residential treatment for 2 years. And also a year I did in dual diagnosis. And all of these people would have, if I could go back and give them aminos, I would. I really would. Would
yeah,
make such a
yeah,
difference. Yeah.
yeah. Me too. Me too. I think of all these clients who relapsed and some even who died before
Yeah.
I knew about amino acid therapy and protein. And this is actually why I do what I do today. And I'm so passionate because too many people have died who didn't need to have.
Yeah. And I worked in a facility with men. It was an inpatient residential. And I would come in really bright-eyed and bushy-tailed, and sometimes I'd sing to people in the hallway, and they'd gather and they'd say, "What's gotten to you today?" And I said, "I'm just in a great mood." So it would set the tone. I knew that it would set the tone for the floor for the day when I came
That's
in up, so I could lift them.
with all that dopamine, you had enough dopamine running that you
At the
could
time,
actually move mirror neurons, lift their dopamine.
yeah. And then I would go into their kitchen and I would see what was provided for breakfast for grown athletic men in their
Right.
20s and 30s. Donuts. I kid you not, Christina, donuts. And I knew at the time, I said, I had come from a bodybuilding background. I said, that's not enough. We can't give, a muscular young man who's 25 donuts for breakfast. And of course, oh, well, the nutritionist knows what she's doing. And I didn't buck the system back then, but I thought, no, she doesn't. She hasn't got a clue if she's feeding grown men in recovery sugar. And then they took away the sugar because they would drink cups of sugar with 3 drops of coffee. So, when they're sugar bug, that they are just really needing a boost. And it would have made all the difference to give these young men bacon and eggs and
Mhm.
ham and cheese, and
Mhm.
even
Mhm.
tofu would have been better than donuts.
Yeah, real food, not only, well, muscle building food, but also brain building food.
Yeah, the walnuts
And
and
craving,
veggies.
yeah.
Yeah, it would have been just night and day. And I would, maybe that's one thing I might do in the future is call up the place I used to work and said, "Hey, I would like to do some CEUs for your team, and
Mhm.
here's what they'll
Mhm.
be about." And you'll be darn sure amino acids will be at the top of the list. Yeah. So
And
it's been.
breakfast.
And breakfast. Oh, yes. A breakfast that isn't my client that I just got cravings chocolate and everything. I talked to you at the three-legged amino club. He sent me his 3-day food mood journal.
Hmm.
Every morning is a bowl of frosted mini wheats and no protein and 4 cups of caffeinated coffee. So
Yeah.
that just sets him up for failure the whole rest of the day. And
Yeah.
cravings, which are way worse. And so, yeah, I can't wait for our next appointment because I'm
To
going to
hear
blow
what's
him away.
changed. Yeah. Yeah.
Yeah.
Well, Michelle, it's been lovely chatting with you about all of this.
I'm just so grateful, Christina, for this mode of work with our clients. I'm so grateful that I met you and that I took the leap and got some training. And it's been life changing for me and for my clients. And once you know you can't go back, you don't see mental health in the same way at all. So
No,
it's
no, you
great.
just don't. Well, more power to you. And how can people reach you?
Easily on my website, it's www.drmichelle with 1 L Perron with 2 L's, Perron,
Come on.
PERRON.com. Yep, that's the best way. Or I'm on Psychology Today. I'm also on LinkedIn there are links on those things. If you just Google me, probably I'll find me.
Okay. And the Academy has a practitioner directory, which you will be in as well.
Yeah. Okay, great. Yeah, I found it the other day and it's lovely. You just have a map and you can blow it up
Yeah.
for where you are. And I am far away from the next closest amino acid therapy provider. And so I love the idea of being an early adapter. I wish
Uh-huh.
we weren't at this point, but someone's got to forge the way. And I'm happy to, do that with you. I just love it. Yeah.
Well, wonderful. And we'll have your information written as well. So have a wonderful day, Michelle, and thank you for showing up.
Thank you, Christina. It's been great.
Bye-bye.
Bye bye.
Okay.
Yeah.
That was fun.
Yeah, that was really fun. Yeah. And I'm sincere when I say how grateful I am for this ability, this knowledge to help our clients. I'm like, doctors should know about this. Like, I see how much work there is to be done. Like, we could clone you 47 times. and
Well, I've just decided we're going to do a live conference probably in Columbus, Ohio,
oh,
next end of April, beginning of May, something like that. And so I want to invite you to speak at that on using the combination of targeted naltrexone and amino acid and diet therapy.
wow, I would be honored to do that.
Yeah, we're just now, I mean, we're just now putting it together.
Columbus,
So,
Ohio.
yes, because I can drive there. It takes like 3 hours for me to drive there.
Oh, nice, nice. I've
Yeah.
never been to Columbus. I had not been to Philadelphia, and that's the first time I went this year too for the naltrexone convention. And like I said, I was there with all these like foundational researchers, and like, well, how did I get invited to this party? But it was good. I had some new ideas as well for them, and from that came a couple of speaking engagements, and I'm going to do some consulting with RIA Health, which is an online provider for naltrexone, and they have coaches, and those coaches need to know what they're doing, and so yeah, they want some help with writing a program, and guess what's going to be incorporated into their program?
Yay. That's so exciting.
Yeah, just educating people one company at a time. And if I could, I would love to just do that for companies too. If I could just go in and train their
Mhm.
staff to learn about this and do this. And yes, this is what I call it now, Christina, is the new modern recovery. The old way was abstinence based and it works for people who like it, but for people who just fail over and over in the abstinence based treatment, this naltrexone based targeted use of naltrexone plus amino acids, it's now forever joined. That
Mhm.
is the new modern recovery. It's more humanistic. It's you feel better sooner, you're more successful sooner, all those things.
Exactly. Well, as I said, more power to you.
Yeah, thank you, thank you. Yeah,
And it's
I
the
look forward to
ripple
it.
effect.
Yeah, yeah.
Yeah. Yeah.
So it's
All right.
wonderful.
I will see you later on then.
Yes. Thank you, Christina. God bless you over and over.
Thank you.
Bye
Bye
bye.
bye.